Hello, today I'm talking about exercise and pain, but first a safety warning. Any new persistent pain must be reported to your medical team so they can rule out any sinister causes, including metastases. So pain is a really common symptom reported by cancer patients, with anything from 45 to 59% reporting pain. But the good news is that exercise helps alleviate this symptom. And if you wait for the pain to go away before you start exercising, you might never start. That doesn't mean that you bust through the pain. That won't work. I'm going to show you how to manage this. So how does exercise work? Well, it helps reduce that systematic inflammation from the treatments and the cancer itself, and it helps release feel-good chemicals. So this is an infographic I use with my patients. So I ask them to rate their pain out of 10. So 0 is no pain, 10 is the worst pain imaginable, and some people don't like that, so I'll just ask them mild, moderate, or severe pain, excessive pain. Anyone in this higher range of pain, so 6 to 10 out of pain all the time, I ask them to have a medical review to see if there's something that can be done to help manage their pain, including medications. So with respect to exercise, it's fine to exercise up to 5 out of 10 pain. So if you do start an exercise and you're feeling pain, rather than just give up on the exercise, first try to modify. So first thing could be the range of motion. So for example, if you're doing a shoulder press, it might feel okay up to here, but as you go, it starts to hurt your shoulder. That's fine. Just exercise in that pain-free range. You can alter your body position, play around with the position. Again, with shoulders, sometimes people, out here is painful, so I'll get them to move there. And yeah, that might feel great. So having a play around with position, having a play around with the exercise. So for example, a lunge might be very, very painful, and you've tried all these modifications. So instead of doing a lunge, you might do a step up instead. You might need more rest time before exercises. It's a common error I see with my patients and exercise. They just don't allow enough rest time in between the sets. You can play around with the frequency of the exercise. You might need to do it maybe just once during the week to start with, and then slowly build up to doing it twice during the week. The number of repetitions. Again, you might have been aiming to do, say, 12, and the first 6 are okay, and then it's like, stop at 6, just do 6 repetitions and give yourself a pat on the back for having done 6. This is your baseline, and in future exercise sessions, you can slowly creep that number up, providing that you're respecting your symptoms. Have a play around with the weight. For some people, they might need to start with air weights. So they might not manage a weight at all and just move your body part through the range. And that is fine. That is your baseline. You get started there and then slowly build up. You can always also have a play around with the speed of the exercise too. So always trying to play around before you decide that an exercise is not for you. Now, symptom or pain response, just say all the time your pain is 4 out of 10. And then after the exercise session, it gets up to 6 out of 10. But provided it settles back to baseline pain levels within 24 hours, yep, that's a good exercise level. Stay there and then slowly build up from there. If your pain is staying above your normal baseline after 24 hours, that's more than your body can tolerate at this point in time. So the next exercise session, you just reduce. So doing less weights, less reps, less sets, and less load. The other thing is you shouldn't lose range of motion the following day. And I'll give you an example of my knee. I've got an old sports injury in my knee, so I've now got arthritis in my knee. And sometimes, if I overdo it, the next day my knee is stiff, so I can't bend my knee all the way. And that's when I know I've overdone it. And my next exercise session, I need to pull back a little bit. So it can be very frustrating when you're in pain. If that happens, I want you to be a scientist, not a judge. So what I mean by that is the scientist will be curious, thinking, why is my pain flared up today? Oh, I increased the weight on my lunges and my squats, and I went for an extra long walk today. So maybe increasing 3 things at once was too much, and I need to pull back on a couple. That's going to be more helpful than being a judge, like, oh, it's terrible, it's never going to get better, etc. But I understand it can be so frustrating. So other practical tips: keep an exercise diary and record what exercise that you did, including sets, reps, the weight. If you're not understanding what these mean, we will go through sets, reps, etc. in future videos. It's good to record your fatigue if fatigue is a symptom for you as well. So record what you did, and you can rate both your pain and fatigue out of 10 before the exercise. You could even rate during, and then 24 hours later. And then based on that information, you can adjust your exercise at the next session as required. So if there was no flare-up of your pain or fatigue, great, that was a good amount of exercise. Keep that up and then gradually progress it. If you were flared up, you know you need to reduce your exercise at the next session. The initial goal is not to make the pain or the fatigue to go away. The initial goal is to gradually increase your activity without provoking these symptoms. Now, for people in a lot of pain, I'll sometimes get them to start a mindfulness-based exercise first, like yoga, Tai Chi, or swimming. So some people, we just can't get their pain under control with exercise. So we might start on these for a little while, and then they'll come back and successfully manage to start a gym-based exercise program. And again, if you've got persistent pain over 5 out of 10, I strongly encourage you to see your doctor. Exercise is such a great medicine with so many benefits. And if pain is a barrier, medication might help you overcome this barrier so that you can get in and exercise. And I've seen with a lot of patients that were very reluctant. They took medication, they only needed it for a short period of time while the exercise started doing its good stuff, and then they didn't need medication, and they were able to reduce their level of pain with the exercise. And I just want to say, complex persistent pain can be a very slow process, even when you're doing everything right. So just give yourself a pat on the back for anything you manage to do. Keep approaching with curiosity so that you can be adapting exercise as you go. Have some fun. If you've got a lot of pain, have some fun. Use playful movements. And if you've got a lot of pain, a more useful question can be, how can I incorporate meaningful activity into my life? That can be far more helpful than how can I make my pain go away? Okay, that's the end of this talk. It always takes me a long time to stop the recording. I'll get there.